Hello, and thank you very much for joining our Facebook Live today on global health. My name is Emily Rose, and I work for Public Health England. Today, we are at the Public Health Research and Science Conference at the University of Manchester. And we will be talking today with Dr. Olivier and Dr. Marie about global health and the important role that Public Health England plays in tackling public health threats, both in the UK and around the world. First off, Olivier, can you tell me what do we mean by global health?
I don't think there's a set definition for global health, but the way we normally understand this is our focus on improving health and reducing health inequalities globally across the world. There's a lot of focus on low-income countries where the burden of disease tends to be higher, but it's not limited to that. It's mostly about understanding that global health is a general wider issue, and that we live in a world that is very interconnected and have public health policies that are applicable across the world.
And some might say that, we should be tackling health inequalities in the UK before we look abroad. What do you say to that?
Well, PHE is involved, and many actors are involved in global health, and I think we have a collective responsibility of tackling health inequalities and looking at health problems from various angles. If we take a UK lens or UK perspective on things, clearly if we think of infectious diseases, outbreaks, epidemics at a local level that may happen in countries overseas, if they're not stemmed or not controlled very early on, could spill over, could have regional impacts or international impacts. And so by engaging with other countries in trying to improve our capacity to detect outbreaks early, to respond to those outbreaks early, and to control them early, we also have an impact, a more wider impact.
Thank you. And we support health protection in other countries. Dr. Marie, can you give more information about that?
Yeah, so one of our roles is to develop sustainability and capability in terms of the laboratory side and also the surveillance side, so that we can support developing these systems in multiple different countries. So currently we have Public Health England have an international health regulation programme that's about supporting capacity in multiple countries, including Sierra Leone, Nigeria, Pakistan, Zambia, Maya, and Ethiopia as well. And we're coming away from the old model of where there's a large emergency outbreak where different organisations globally will go in, support, set up systems and then leave, whereas now we want to have much more a collaborative approach where we have long-term development over several years to develop people to be independent. And this isn't work that's just undertaken by PHE. All of the organisations within the countries, it's a partnership, and we get a lot from them as well as we do personally. So, for example, you get to see diseases and systems that you don't necessarily see in the UK, and you bring that skill set back to the UK as well. So it's definitely a partnership between England and the other countries.
Thank you. And can you give more information, because you're part of the UK Public Health Rapid Support Team, can you give more information about health protection and how and what that looks like?
Yes, thank you. We as part of a rapid support team, we on the response angle, so we respond to epidemics or emergencies that happen overseas, mostly responding to requests from ministries of health or international organizations, typically WHO, if there's an outbreak that may require support. We are a joint partnership between the London School of Hygiene and Tropical Medicine and Public Health England, so it's a joint team. And the reason for that is that we work across different pillars. Marie just mentioned capacity building, and that's something we do a lot as well in terms of capacity building for outbreak response, research towards epidemic response, but then also deploying to various settings. And I think over the last couple of years, we've deployed to about 8 or 9 different places, responding to either emergencies or outbreaks.
Marie, so you head up the Salmonella Reference Laboratory, but you've been spending a lot of time abroad in Nigeria and Sierra Leone. Why is that?
So as you mentioned, my main role is based in the Gastro Reference Laboratory for Public Health England, but we also have a remit to help support international, expertise and develop systems. So I first became involved in 2012 in Sierra Leone. There was a huge outbreak of cholera, and I went out there to help set up a laboratory for diagnostics and reference servicing on enteric pathogens. And then since then, as part of the International Health Regulation Programme, I have set up with a team an enteric workshop that has practical and theoretical aspects to teach them about isolating and diagnosing cholera, Salmonella, Shigella, E. coli, also training in antimicrobial resistance. So we've been very much involved in that and working with the scientists to set up laboratory systems to high quality standards and set up safety systems. And on top of that, PHE have also got leadership and management programs. So it's a whole holistic approach to developing scientists and leaders within the countries.
And so, Olivier, what is the most difficult challenge you've faced as part of the Rapid Support Team?
Well, I think there's always challenges when you deploy to a new setting. We've had numerous deployments recently, be it to Democratic Republic of the Congo, DRC for Ebola, or Bangladesh for the Rohingya refugee crisis. I think every setting is different. There's always uncertainty when you deploy. But personally, as an epidemiologist, one of the things we work on is very much data-driven and setting up or strengthening systems for surveillance or enhanced surveillance during outbreaks, or surveillance to put in place during an emergency, for example, to make sure we can pick up epidemics quite early on. One of the challenges is to balance the complexity of systems or what is existing with the need for speed and to be able to implement something rapidly and be pragmatic about the tools we use. We work in settings where sometimes the infrastructure is difficult, or there's a poor public health infrastructure, or the road access might be difficult, or network connectivity might be difficult for example, surveillance with electronic tools. So we always need to adapt. But there's a lot of challenges in simply trying to implement our work and tailor our approach to the setting we work in.
And what is a sort of rewarding aspect of your job?
There are many rewarding aspects. For me personally, is also being able to work with a community of people, a community of practice from various different backgrounds and organizations on the ground. Generally, we work in during deployments and outbreaks in very intense, time-pressured environments where people tend to be quite stressed. We work 24/7, but we also get achievements, quite quick achievements, with a group of people we work with. And so generally the positive achievement we get and trying to work with people from various organizations is always very rewarding when we manage to eventually put in place something.
Marie, what's been a career highlight for you so far?
The career highlight with working with the global health is just seeing these scientists develop. When you first meet them, you don't necessarily have the knowledge or the skills, and then after working with them after a period of time, you can just see, how they improve. As Oliver mentioned, it's a very intense environment and very hard work, but it's incredibly rewarding. And, you mentioned about challenges. As a microbiologist, we work in a laboratory and we have similar issues of infrastructure. So, for example, electricity, might not be there and you have to, work around that. And I think the favourite challenge that I had of working in global health in the laboratories was when I was working in Sierra Leone. I was out there for about a month, and I remember snacking in bed and waking up, and there was these little tiny ants on me. And I was speaking to laboratory staff, and they were laughing at me. Everybody knows you shouldn't eat in bed because they have these little sugar ants. And I didn't really think anything of it. And in the laboratory, there was these little sugar ants that were calling over the media because there was sugar in the media, and they were favouring the media. And initially, I just ignored them, didn't think anything of it. And one morning, I opened the incubator to look at one of the plates, and we could see where you had inoculated the plate, and that an ant had come and crawled along the plate. So you could see little footsteps of the ant with the bacteria within the plate. So that was really interesting. So we got rid of the ants, but that's like I say, a good thing. You get experiences of challenges you just wouldn't get in the UK, and you have to be very adaptable to work in those situations, and it's incredibly rewarding because you grow as a person as well.
Definitely. And so, that's a hard act to follow, but what has your career highlight been so far?
I've not had ants or sugar ants, but we similar situations for sure in various deployments. I think there's no particular highlight, but really being able to contribute to different responses, and in the same sense, being able to actually have the feeling to achieve something, and that there is some capacity building when you're on the ground as well. I think is actually the most rewarding aspect of any work you can do, more than the work itself. So that's certainly, be it in Bangladesh or more recently in DRC as well, when we were involved there.
Thank you both. That's the end of my questioning, but we do have some questions from the audience. The first one is, what one piece of advice would you give to budding scientists? I think, Marie, you might be best to answer this one.
So interestingly, the type of advice, what I would say is be highly organised. Now, when you go out there, you have to be very adaptable to the situation. But for example, a lot of the laboratories don't have access to clean food or water, and you can be there for 8-10 hours a day. And we don't have air conditioning. It can be very hot in 30 degrees heat. So when I go out there, I take lots of snacks, and I make sure that I stock up on the snacks, and I take water when I'm out in the laboratory. So it sounds like a minor thing, but actually I would definitely recommend that.
And we've had another question in that's asking, what are the benefits of a career working abroad on a personal level? Would you be able to answer that?
Sure. I think there are a lot of benefits of being exposed to different settings. It's a huge learning experience each time you go to a new setting, be it a new country or even within the country, to work with a new organization or with new partners. So from a learning perspective, I think we all learn as we work and as we progress. And for me, it's always been a learning journey, a learning experience each time I've deployed. So personally, it's been of huge benefit in terms of my how much I've discovered and the people I've met on the ground as well in various places.
Do you echo that sentiment as well?
Yes, definitely. And I would say I've definitely grown as a person, not just as a scientist in terms of the skill that you get, but also the confidence as a person, because it's very rewarding and very motivating. They're so grateful with the work and the knowledge that they're getting, and you just realise that you're making a difference. I think it makes you quite humble as well. We take a lot of things for granted, and you see the difficult conditions out there, and you feel very blessed for what you do have. So yeah, it's an amazing experience.
We've had another question from the audience asking, do you just focus on health protection, or do you help tackle obesity and smoking and do more health improvement work abroad?
It's a good question. PHE, the Global Public Health, and PHE are involved as well in some work on non-communicable diseases. It is not a work I personally am involved in, so I can't say very much about it. But certainly, it's also a big health issue and a global health issue, and something we should be engaging in.
I think that is the final of all of my questions. Do you have one final takeaway that if somebody watching today had never heard about global health before, do you have a final takeaway for them?
Global health affects us all because infectious diseases have no boundaries, and if you have the opportunity to get involved, you'll find it very rewarding, and it does end up benefiting us as well as the other countries.
I think Mary said it all. Thank you.
All right, and thank you everyone for watching. Please do comment, continue commenting on the Facebook Live, and we will answer as many as we can. Thank you everybody, goodbye.